Hello, and welcome to The Breakdown with Dr. Mooney. If you haven't already, go ahead and hit subscribe. So, I know in my last video, I said that we would be talking a little bit about how to find a primary care physician, but unfortunately, there are more pressing matters at hand. Today, we need to talk about the flu. We are seeing higher rates of influenza than we've seen in the last 25 years. Travel, the holidays, everyone gathering, no one masking, and decreased access to flu vaccinations has led to the perfect storm for this flu outbreak. Unfortunately, in Ohio, we have just had our first healthy pediatric death from influenza. Her name was Riley. Her mother took her to the pediatrician where she was diagnosed with influenza. And per usual, the pediatrician let the family know things are going to get worse before they get better. But little did the family know that things were going to get really bad very quickly. Her mother reports that in 24 hours, her fever went from somewhere in the 98s to 105. She developed pneumonia, sepsis, and eventually ended up in the pediatric ICU. Unfortunately, Riley coded, where she ultimately passed away from complications of influenza. This poor baby was only 16 years old. This news may come as a shock, but for those of us who are familiar with this nasty virus, unfortunately, we know that this is a known complication of the flu. Common society has us thinking that the flu is just a common cold, and I promise you with all of my heart that it is not. I repeat, influenza is not the common cold. Influenza is highly virulent. It's very smart. It mutates all the time in order to become more crafty and more efficient with infecting millions of people every year. It's important to note that the flu can infect anyone. We know that children, older Americans, pregnant women, and immunocompromised individuals are at the highest risk for a deathly encounter with the flu. So let's take a step back. Everyone says flu this, flu that, get vaccinated, but doesn't actually explain at its essence what the flu is. The flu is a virus that primarily infects the respiratory tract, the nose, the lungs, and the entire respiratory system. There are four main types of influenza: influenza A, influenza B, influenza C, and influenza D. Influenza A and B are typically the ones that you hear about. Influenza A is what's the most common this flu season. Influenza C causes a lot more milder symptoms, not too much of something you'll see in the news, and influenza D primarily infects livestock. It's important to note that within these four categories, there are hundreds of different strains of the flu. Each year, the flu gets smarter and smarter about how it's going to evolve to evade our immune systems and continue to infect people for years to come. How is the flu transmitted? Well, the flu is a master virus that can be transmitted through droplets or through touching contaminated surfaces. So that means if somebody sneezes, coughs, rubs their hand, and slaps a desk, and you come by after them and touch that desk, chances are you're going to get the flu as well. Also, important to note that flu season is the time where you're most likely to get the flu. This is usually like September, October, all the way through January and February. However, you still can technically contract the flu outside of these months. So picture this. You're on an airplane and you're going to Disney World with your family. You're 3 rows ahead of somebody who is coughing up a lung with no mask and not covering their mouths. You think, okay, I'm not directly next to them. There's no chance that I'll get infected with the flu. Is this accurate? No. Those droplets that person is coughing, coughing, coughing can travel into your row and you can become infected with the flu. Here's another scenario. Let's say you are not feeling your best, but you've got to do the mom stuff. Your kids want bananas for their lunch tomorrow, so you're going to the store to make it happen for them. You sneeze, achoo, but you make sure to cover your nose and your mouth, but you sneeze on the back of your hand. You then wipe your body with the back of your hand and touch your cart. As you're walking through the grocery store, you pick up different boxes and you check out and go home. Could you have potentially infected somebody with the flu? The answer is absolutely yes. The thing about the flu is that it can live in the air for up to an hour after those droplets are released, and also can live on surfaces anywhere between 12 to 48 hours after the original point of contact. So just because you do not see somebody with your eyes that is infected with flu and actively spreading droplets does not mean that that person did not infect you. And another challenging thing about flu management is that you can walk around for days actively infectious without symptoms, and you won't even know that you were exposed to the flu. So, how do you know that you have the flu? How do you distinguish this from a common cold? Well, generally, if you have body aches and a high fever, something is wrong. Please investigate. Other symptoms, of course, are cough, fevers, chills, headache, fatigue, or something we call malaise. Malaise means that kind of feeling. In children who are too small to communicate what their symptoms are, they're going to be irritable, they'll have high fevers, probably rosy cheeks, they might actually have some stomach upset, nausea, not wanting to eat anything, or they may have diarrhea. Generally, if you're not feeling well this season, please stockpile some influenza A and COVID swab tests that you can get at any pharmacy. You can get them on Amazon. They're about $10 to $15, and just make sure you have those kits at home. Most people who contract influenza are totally fine. They take a few days, rest, relaxation, fluid hydration, ibuprofen, Flonase, and they're able to thug it out. However, not all people are that lucky. When should you see a doctor if you think that you do have the flu? One, if your at-home test has turned up positive. Two, if you're having shortness of breath, chest pain, dizziness, inability to open your eyes, and confusion, as well as a fever higher than 104, definitely go to the hospital ASAP. Also, did you guys know that there's a treatment for the flu? If you get Tamiflu or another antiviral within the first 48 hours of your illness, you likely can decrease the length of illness for yourself by several days. However, it is very important to note that this is a virus. A virus will not respond to antibiotics. I repeat, do not give yourself antibiotics for the flu. It will not work. The best way to prevent the flu and to protect yourself is to get vaccinated. There's a lot of controversy around vaccines right now, but what we do know is that vaccines work. The vaccine will not prevent you from getting the flu 100% of the time, but more often than not, it will prevent you from ending up in the hospital in relation to your flu infection. It can decrease the severity of the disease that you have after you've been infected with the flu. Something easy you can do, whether you vaccinate your children or not, is to wash your hands. For the love of God, if I had $1 for every person I see walk out of a public bathroom without washing their hands, I would have enough to pay my student loans. Wash your hands so that you're not touching other substances that contain flu particles, okay? And disinfect everything. Many cleaning companies have little portable disinfecting wipes that you can either put in your pocket, put in your purse, or put in your kid's book bag so that you can disinfect every substance that you come into contact with that could potentially be carrying the flu. Remember, the flu is dangerous. The flu is deadly. It has been so almost since the beginning of time. Your symptoms can come on suddenly and ferociously. It's important to be very vigilant with yourself and with your children. Monitor their respiratory status, and if you feel in your gut that things are about to go south, take them into the hospital immediately. You can be treated if you seek care within the first 48 hours of your symptoms. Make a telehealth appointment, go to urgent care, schedule an appointment with your primary care doctor, get help. And lastly, if you are feeling unwell and you don't absolutely need to leave your house, stay home. You don't need to go to the movies. You don't need to go to the grocery store. You don't need to go to the mall. Us leaving the house and walking around infecting each other with no masks, not washing our hands, and not giving care to our neighbors is what is causing these children to die. We don't need to continue having these calamities for a virus that is completely preventable. If you've learned anything from this video, please remember, you can be treated if you seek care within the first 48 hours of your symptoms. Wash your hands, disinfect the surfaces, and stay home if you're sick. Thank you for tuning in to my emergency broadcast of The Breakdown. If you have any topics that you want me to explore other than viruses, the flu, other common illnesses, please go ahead and drop your suggestions below. Until next time.